Hello and welcome back to PEBC with me. I know that psychiatric disorders and their treatments can get really confusing, especially for PEBC prep. So I've simplified it for you with this step-by-step chart to help you understand acute agitation in less than a minute. Let's go through it together, and don't forget, MCQs are coming next in shorts. In our first video, we talked about the management of acute agitation, but I know it can feel complicated when you're just reading text. So in this video, I've turned that into a simple visual flowchart to help you remember everything easily and quickly. When managing acute agitation, always start with 3 key steps. First, ensure the safety of the patient, staff, and environment. Second, determine the cause of agitation. And third, try non-drug interventions like calming the patient, redirecting their behavior, or using physical restraint only when absolutely necessary. Now let's go over the possible causes and how to treat them. Delirium. If the cause is delirium, give a first-generation antipsychotic such as haloperidol or loxapine, or an atypical antipsychotic. Dementia. In dementia, only medicate if there's a risk of harm. Treatment options include first-gen or atypical antipsychotics, trazodone, or cholinesterase inhibitors like donepezil, galantamine, or rivastigmine. Benzodiazepines can be used with caution. Brain injury. For brain injury, use beta blockers, anti-epileptic drugs, or antipsychotics depending on the symptoms. Substance-related agitation. In cases of intoxication, give haloperidol or lorazepam. If it's alcohol withdrawal, treat with diazepam. Situational causes. Use first-generation or atypical antipsychotics. You can also add lorazepam or benzodiazepines if needed. Mental illness-related agitation. For mania, use an atypical antipsychotic, or a first-generation antipsychotic with lorazepam, and add a mood stabilizer if needed. For psychosis, treat with an atypical or first-generation antipsychotic, and consider adding lorazepam. Make sure you've watched the first video for full context, and don't forget, MCQs are coming up next in shorts. Thanks for watching, and if you have questions, drop them in the comments. And no, that meme isn't me, but it could be you if you don't revise.